Speaking because some of our doctors who weren't able to come today, we do have Dr. Travis Johnson, owner and longevity chiropractor of Hudson Spine and Health, certified advanced biostructural correction chiropractic technique, cranial sacral therapy, posture expert practitioner, functional cranial release balloon, and metabolic health. Dr. Johnson created an integrated holistic clinic experience for physical, chemical, and emotional imbalances. He merges primitive tactics with modern technology. He practices regenerative agriculture with his wife and animals and enjoys all activities in nature. He's also one of the leading health providers in biohacking and natural medicine space. Ladies and gentlemen, live from Zoom, we have Dr. Travis Johnson.
All right. Thank you so much for the introduction. All right. So what I'm going to go through today is really going to be a combination of a protocol pretty much developed by these individuals here. Dr. Jason Sonder, I'm stepping in for Dr. John Laurent, and then Brian Richards from Sonospace as well. And I'm going to talk about more methylene blue specifically. And we're going to go through what is synergistic with methylene blue as well, and how this pertains to hyperbaric oxygen as well. So Mito red, it's red light, blue, methylene blue, O2 oxygen protocol. So we're going to start with just the history of methylene blue. Why would you use methylene blue, and how has it been used in the past? So this Paul Ehrlich, he was the first one to really understand and find that methylene blue had a profound effect on the cells that he was trying to dye. So he was actually just doing this. He found this blue salt, which methylene blue is, and started to dye this malaria cell, and found out that it actually killed the actual bacteria. And what it also did, which was really interesting, is it saved the host cells too. So it only killed the bacteria of the malaria. So there we go, Nobel Peace Prize winning for curing malaria. And that was its really first big introduction into the world. He coined it the magic bullet because of that exact reason. It had this ability to kill the disease, but also leave the host unharmed. So that was really unique, and one of the most unique aspects about methylene blue that you'll come to find out through other mechanisms. It is a antidote for the methemoglobinemia, which is basically like a red blood cell issue. Currently, they'll use methylene blue in our hospital systems for anybody who has cyanide poisoning or carbon monoxide poisoning. So it's really good at neutralizing those poisons within the blood. Very good antiseptic for wounds, for antimicrobial properties. Blood transfusions. If you've ever had a blood transfusion, they will use a little bit of methylene blue within there to actually kill off some of the pathogens, and even some red light too, to irradiate the blood as they store the blood from there. Widely, back in the day, they would widely use methylene blue for UTI infections. Depression is another huge one that's kind of recently been shown to help with. So mood stabilization, and then neurodegeneration. So we'll talk more in depth about these ones, but those are kind of like the uses that historically have been used for, and then what currently today we're trying to get into, like what else can we find that methylene blue is helpful for. Okay, so what exactly is methylene blue? It is a dye. It's a blue dye, a blue salt dye that they originally would use just to dye clothes. And then they started understanding, well, you can actually dye cells in different anatomy parts of the body to differentiate organelles, like the mitochondria and things like that. And then what they found when they were dyeing these cells is the methylene blue had this high affinity for mitochondria. So if I were to take, let's just say this 180 milligram bar here, so one of those squares, my entire body would be dyed blue from the inside. my brain. It'll cross the blood-brain barrier. It'll go through every cell in the body through the blood, and it's going to have a high affinity for the areas of high mitochondria. So we're talking eyes, brain, and heart. So things that require millions of mitochondria to be in per cell. And you could actually see, like if I had an X-ray of myself and I could see all the blue, you would see those parts light up. So now we know where our mitochondria are mostly held through our bodies. So that was a really cool finding. And then how do you deliver methylene blue? There's a few different ways I will share. The most commonly known is through like oral. So there are sublingual liquid forms you can get. And then obviously Dr. John has his product here, the Lumitol Blue, which I have found to be one of the top ways to ingest methylene blue, because you don't have to get that super blue tongue and teeth, throughout the rest of the day. You can just swallow it, have it go right into the stomach lining. And then also you can do IV, which is another high potent version of a delivery system, more for, infection type stuff, or like a clinical application. And then there's a few other ways, and then I'll share that later on as well. So dosage for methylene blue, it's going to vary based on what you're trying to do with it. So there is a wellness or kind of a health optimization dose, I would say, where you're just doing it for like a brain boost, a mood boost. Maybe you're just looking for longevity to have your cells function the best they can. Then if you would probably go towards that 0.5 milligram per kilogram of body weight. And now if you're somebody who's fighting some infection and you are, pretty sick, or you're traveling a lot and getting exposed to a lot of toxins and viral exposure, things like that, then you can up that dose more as a kind of a preventative approach, or even to treat some kind of a acute reaction or infection. Then you can go upper to that 4 milligram per kilogram. So for, just to do the math, for instance, I'm 160 pounds, I'm about 75 kilograms. So the low end, 37-ish milligrams per day, or per 12 hours, because the half-life of methylene blue will be 12 hours. But per day is how I would use it. Upwards to 300 milligrams in one sitting too. And that would be, like I said, if I was really struggling. All right, so what's really unique about methylene blue, which is probably the most unique and reason why it's so popular today, is it has this both electron donor and receiver property to it. So that's really useful when you're talking about mitochondrial energy and cellular respiration, because it allows itself to kind of move electrons around, whether this needs more, this needs less. It balances out the actual cell, and specifically the mitochondria, and in this context, so that it runs efficiently. And so it prevents an oxidative state. So we're not getting this huge inflammation response to produce a lot of energy, which can happen. That's how an oxidative state would happen. So because of this efficient property it has to gain electrons or donate electrons through the Krebs cycle here, it will improve the efficiency to produce ATP around 30%. I think that was the average that we'd find. It would improve its ability to produce more ATP, and just with more ease. And again, it's killing it. So that property alone is how it allows to kill these pathogens without actually harming some of the host cells as well. The only time I would say that this may not be advantageous is if you are getting high doses of methylene blue deep into the gut. So like, we want the methylene blue to be absorbed in the stomach and then get to the bloodstream through the stomach. If we are getting methylene blue past the stomach, so like let's say it's encapsulated, and that encapsulation didn't dissolve in the stomach and it pass through the small and the large intestine, then that methylene blue might give some gut disruption and even kill some of the beneficial gut bacteria as well. So there is something to think about when you talk about delivery systems, and that's why having something not capsulated like that bar, or something like an IV or a liquid, would be the best way to absorb it quickly. Okay, so and then some more additional properties. How is it being used, and what's so unique about methylene blue? As I mentioned, it's acting as a redox agent. So the big one here, antimicrobial properties. So its ability to fight off a wide range of bacteria, viruses, and fungus, when it enters these cell environments. Now, what they found, and I put COVID there because they found that this is very protective, to prevent a viral, kind of reaction. It was in France. They gave 2,500, I think it was elderly individuals in this hospital setting, gave them all methylene blue, and over a course, none of them got infected from influenza during like the peak influenza season. So it was a very interesting show that methylene blue can be pretty protective from actually contracting viral infections as well. Another huge one today that you'll notice, neuroprotective abilities, especially with their dementia and Alzheimer's patients. Again, we're talking about energy systems within the mitochondria. This crosses the blood-brain barrier. So we're talking neuronal, activation, mitochondrial function. The brain highly innervated by mitochondria. So if we can activate, those cells within the brain for memory consolidation or cognition, they're going to be able to, fire more neurons. They're going to be able to have a lot more energy within the brain, and literal energy, like ATP energy, not just like what some of us like, I feel better. It's like, no, you actually are functioning better too. And then this comes down to the cell metabolism state too, because as you may have understood this, cancer is not really genetic that we thought it was. And so it's this fermentation aspect of, the cell is turning into this acidic environment, creating a fermentation to create a cancer, right? So if we can give the cell the energy it needs to function normally, this can actually be a really, interesting concept for actual affecting cancer cells too, because we're giving them the proper energy to fight off, say, a mutated cell, but also allowing higher oxygen contents to come in too, which will make more sense as I go through the other therapies that are in conjunction with methylene blue. And then big one, mood enhancer. This is something that you will probably feel first when you have tried methylene blue, if you haven't experienced it yet already. So depression, they've shown that it works on these serotonin centers of the brain. So it literally acts as an SSRI. So, when I have patients come into me and they're like, I'm not supposed to take methylene blue, I Googled it and it said that if you're an SSRI, the AI Google thing told me I can't take it because I'm on an SSRI or MAO inhibitor. And I'm like, well, yeah, but if you think about it, it's because you're taking two of the same things. Would you? And you got to read the risk and reward. Which one has more side effects, contraindications, and which one is more safe and more manageable from a dosage standpoint? And so you just have that conversation with them. Like, listen, you don't have to be stuck to these SSRIs the rest of your life. This may be the ticket to wean you down and maybe off of those. Okay. And just, speak to them as if you were my sister, that is what I would tell you to do. You would wean yourself off into something that is a lot more safe and manageable, without these other, side effects. Very interesting. It's funny that the methylene blue activates this blue spot in the pons, called the locus ceruleus. And Dr. John mentions this one quite a bit because it has so many unique properties with carbon dioxide and you kind of governing epinephrine, but also like memory consolidation. So they were doing studies with therapy for patients and noticed when they gave them methylene blue, they had a lot better success in their phobias specifically. So it allows them to convert this short-term memory and actually convert it to a long-term memory. Okay, so specifically with this phobia study, they noticed that the methylene blue would activate this spot of the brain, and that was pretty beneficial as well from a therapy standpoint and a behavioral or mood standpoint, which is very important. We're talking about today, with depression and fears, right? We have so many fears going on like today, right now. So dealing with that from a physiological standpoint is pretty nice. And then neuropathic pain. So neurology, right? So pain is really just a signal of your nervous system saying there's something wrong, right? So if we can decrease the inflammation and decrease the pain, that's gonna be beneficial for the rest of the body and the system to lower the cell danger response, right? And keeping the body out of that sympathetic state. So we can get more into a healing parasympathetic state. And so methylene blue really helps with lowering some of these inflammatory markers within neuronal pain specifically. Okay, there are some considerations to address with methylene blue because there are some contraindications that are extremely rare, but a lot of this has been way overplayed, especially if you're just going to do like Google searches. And the big one is the SSRI one and the MOA inhibitor. So, obviously, if they are on those medications, make sure you consult with their doctor that this is something they can do. Or even if it's a really low dose, there's no signs that a serotonin storm would happen with the dosing that we're recommending, the 0.5 to 4. It won't happen. I think the one case report where this actually did happen and the patient ended up passing away was during like a thyroid surgery, and they placed like 500 milligrams of methylene blue like on the thyroid, and it blew the person into a serotonin storm. So like super unique case, right? So it's not as fear mongering as we may have seen. This G6PD rare genetic disorder. If somebody does have that, usually they'll know they have that rare genetic disorder, the G6PD. They should not be taking methylene blue. It's not going to help their red blood cells from not destroying themselves. So be careful with that one. Psychedelics, we need to be aware of it. These are working on the serotonin centers. So if you're already ramping up serotonin from a psychedelic experience and then adding methylene blue, they are going to enhance each other because they're both kind of exacerbating their serotonin system. So do not be doing high doses with those together. If it's appropriate and it's managed through a clinician that understands, you could do like a microdose of doing those together. Pregnant and breastfeeding, we say no. We don't want to injure any more risk to the baby, miscarriages. So that is a contraindication as well. Pregnant or breastfeeding females. I mentioned the serotonin storm one. Very hard to actually achieve that with the dosing that we're describing. They had a study here. They gave these patients 500 milligrams a day, every day for a year. And they had little to no side effects. So there's just proof right there. Like that's way above what we're, recommending. And there's no negative side effects there. So you will urinate blue after you take this. And it'll may happen for the next 2-ish days. It'll be like dark blue if you're taking a high dose. And that's usually a pretty good indicator that we know you're taking a therapeutic amount. If you don't see yourself urinate blue, you may not be getting that full therapeutic amount where we want to be fully saturating the cells with. And then be careful with the toilet. It will dye white toilets, especially if there's calcium built up on there and missing. And just be careful with the product in general. It will dye clothes, surfaces, cutting boards, anything it touches, permanently blue. So I like to actually use like a paper plate and like a knife, and I can kind of cut my pieces on a paper plate and then use it and then throw it away and not touch anything else there. So just be careful there. If you do the liposomal drops, under the tongue, again, your tongue's gonna be super blue the rest of the day. You can use baking soda to kind of wash some of that out. It'll help reduce the blue tongue. That's why I advise the Dr. John Lumitol one, because you can just put it the back of your tongue, drink it with water, and just swallow it right away. So there's nothing there. And then you can combo it with ascorbic acid, so the vitamin C, and it will decrease the urine color, and it actually has some synergistic effects with vitamin C. All right, so how this plays a role within a clinic setting and photobiomodulation. So red light therapy, we have saunas, we have near infrared, we have red light, specifically the 660 nanometer length. And here you can see a array of devices that we can utilize. Again, it's all kind of case dependent on what they're struggling through. Is it a brain thing? So if it's brain and blood, we can talk about the intranasal or the skull cap there. If it's full body, maybe it's like a fibromyalgia or something like that, then you can do the full body panel, a full red light bed. If it's something specific, like an organ, like a liver, then we can talk about one of those wands and just place it right over that structure. And then we got, of course, some orifice issues. We can do rectal, we can do vaginal, and there's a wand there that be utilized for that, even prostate. There are some uses to use photobiomodulation to actually activate this methylene blue. Methylene blue is blue, red light is red. So the colors actually absorb each other. Okay. So the red photons are going to be attracted to that blue color because it's very photodynamic. It's very shiny within the cell. So it's going to actually grip onto those photons and use those photons as information and actual energy, electron energy, to produce into ATP. And again, get that whole cascade like we understand red light therapy to be, to explode nitric oxide, the cytochrome C oxidase pathway. And you'll notice you'll get an enhanced effect for the red light with the methylene blue in that cell. Okay, so they're very synergistic in how they talk to each other. And there's other components you can use too. With gold is very photodynamic, silver very photodynamic, chlorella, spirulina, all those things are acting very similar to how methylene blue is, where it's reflecting light and kind of enhancing the effects within the cell. That's why it's called cytochrome, right? Cell light, chrome oxidase pathway. So this energy is made by these electrons, and then the photons are basically enhancing it, okay? And what this is doing is releasing the endothelial specific nitric oxide, okay? So there's a few different types of nitric oxide that we want to hit on. The endothelial nitric oxide release is the good stuff. That's the vasodilation. That's how we're getting the blood flow, tissue repair, things like that. And then there can be some negative effects of certain nitric oxides as well, because nitric oxide, as we know, can be a stressor. It is a free radical. And so this gas, the inducible, nitric oxide can be detrimental to some tissue if you have long-term chronic exposure to that specific type of nitric oxide. But the red light specifically, good stuff, endothelial. Hyperbaric is also going to work on the endothelial. And then the methylene blue, again, like I mentioned, it's grabbing these red photons. 660 is kind of like the keystone, most researched nanometer length, but anything between 600 to like 900 will be beneficial too for specific things. So like, I know like the eyes is 870 nanometers. So like that one is more specific for the eyes. So there's different organs, different cells throughout the body that kind of get activated a little bit better for specific nanometer wavelengths. Okay, and then now we're talking about brain, because I know a lot of hyperbaric people are utilizing this for like brain stuff, infections, cognition, cancers, things like that. So transcranial photobiomodulation also can be utilized. Like I mentioned, the brain is getting saturated through the methylene blue. We activate it with a near infrared high power light or laser to activate this brain energy stimulation. And so we have a well-established research that the photobiomodulation through the brain is very impactful for these neurodegenerative patients. Again, you're adding methylene blue, you're getting another cognitive benefit. You're adding, high oxygen saturation to the brain, you got more benefit. So you can see how these are all very kind of biostacking on top of each other. And they're just making this profound change rather than just doing one of these. And then we got the IV. So as you can see these pictures, we got an IV methylene blue bag here. It is getting activated from that little red light panel. And then from there, we can use whatever cocktail you want within that bag. And then you can see here, very specific type of IV. This is a lumitol blue IV. So this is like a methylene blue IV activated by a laser. Okay, so it's literally getting activated right before it enters the bloodstream, again, to potentiate the effects that they are both going to do. And then you can also see they make an eye drop as well. That one's a pretty nice add-on if you're having eye issues, like any kind of infection in the eye, styes, visual issues. There's a lot of different benefits by actually using some eye drops as well. That's a very low dose methylene blue, so you don't have to worry too much about that one. But it does add some more photoactive properties in there too, with some ketone minerals. You got some silver, you got some gold. Those are all very photoactive, meant to be exposed to light. Okay, so out in the sun, in front of a red light panel, those type of things. All right, and then we got the red blue 2 at home, so you can do different things at home. If you have a hyperbaric at home, you can kind of do the red light. You can do the sauna space. That's what I use at home. So you just literally take a methylene blue supplement. You would go into a red light situation, and you could do the hyperbaric oxygen before, the red light even, or during. You can do breath work within the red light sauna. So a couple options, you can utilize it there. I'm going to mention this just because it's kind of a kind of breaking edge thing that Dr. John is doing with the prostate. Maybe you've heard of it. Men are suffering a lot with this hyper, prostate enlargement. And he's having some pretty good success with these individuals where he's actually going through the prostate encapsulation. And he's noticed that a lot of low-grade chronic infections happen within the prostate because there's no way to kind of recycle the toxins out of there. And so he's injecting ozone, some antibiotics, and then methylene blue to basically kill and stabilize that toxic environment. And then there you go. You can see you put a wand and just further activate that methylene blue after the procedure is done. He's had some pretty profound results from doing that just the last year here. And then how does this correlate with what you guys are doing, the hyperbaric oxygen? Well, obviously, we're talking about wound healing, formation of new blood vessels, this anti-inflammatory reaction, obviously the ischemic conditions, infections. So like even like Lyme, we understand that like you can treat Lyme, with an antibiotic if you get it right away, but then there's nothing you can really do once you get to that stationary Lyme where it's like it's been in the system. And methylene blue was actually one of the chemical compounds that actually shown to kill the stationary Lyme. So all your Lyme patients that are kind of have had it forever and can't get rid of it, you can combo the methylene blue to help eliminate that. We talked about the cancer, again, cellular energy. neurodegeneration, the Alzheimer's, the Parkinson's, the dementia patients. They're all having this metabolism issue within the brain. The methylene blue is helping that respiration process to happen. Okay, so you can see we're improving the mitochondrial function, we're improving the cellular oxygen utilization through that, and then by doing that, we're reducing the oxidative stress on the system as a whole, as a cell as a whole. And so that makes total sense when we're talking about hyperoxygenating the blood and these cells. We know cancer doesn't exist where oxygen is and exists where glucose is going to be. So those are pretty obvious stuff at this point. And then just the nitric oxide thing again, the methylene blue, the hyperbaric oxide, they're going to improve the endothelial nitric oxide production, which is great for all the, the blood expanding benefits. But then methylene blue will specifically neutralize this negative actual nitric oxide in the brain, which can cause tissue damage. So it's been shown to actually stop that specific type of nitric oxide. And then again, improving cellular respiration when you're combining these three specifically. So that's kind of like the red, blue, O2 protocol, where you're doing methylene blue, you're doing some kind of an oxygen, therapy. It could be breath work, it could be EWAT, it could be HBOT, and then you're finishing off with like a red light exposure or sun exposure. And then, you can do that, 2 to 4 days a week and have a pretty nice protocol. And you could, like you guys already talked about hydrogen, PEMF, these things are all just going to accentuate what these are already doing. There's not going to be any contraindications to do these other therapies with it. I have I have a hydrogen unit here. I have a red light bed here. We use methylene blue in conjunction with all of them. So we're trying to give this person a 2-month healing blast for their cells to figure out how to heal themselves. If you give the body what it needs, it really has the intelligence to do itself. That is all I have for you today. This is where you can get a lot of good information on methylene blue and kind of hyperbaric oxygen. This is Dr. John's book, the methylene blue, the magic bullet. And this is where I got a lot of my information from. And it's been an honor to speak with you guys today, and hope you guys have a great rest of your conference. Any questions?
Thank you, Dr. Johnson. Actually, we do have a panel later, but I believe Tara Smith will be subbing in and helping us out with that. So we do appreciate subbing in for us last minute. Thank you so much.
You're very welcome.
All right, everyone, we still have one more. So we're going to be